So, did you know that massage is not just for pampering? Most of the massage therapists at Firefly Hollow are doing work that's therapeutic. So this gentleman here is having some low back pain and some right pain, specifically on this right side. So one of the things a lot of massage therapists will do is they might just work on that area. But we're going to show you a little bit about more. Our therapists are trained to work different areas that are correlated to that low back. One of the things we did for this gentleman today, and if you're ever getting a massage anywhere and you need adjustments, you do not need to hurt on the table. So what we did today is we raised the spacer's cradle up higher and we put a pillow underneath his low back because he has a little bit of a hyper curve in his lower back area. And because of that, by putting a pillow and bolstering it up underneath, we're lifting up his back, we're lifting up his spine and creating some support there so that we can get into the tissue and the tissue is not guarding itself trying to hold the back a certain way. So now when I'm working on him, I'm going to be able to release what's going on a little bit better. One of the other things that you will notice if you work with a massage therapist is they might ask you, is it okay if I work on your glutes, aka your butt? And so one of the things that people, it's kind of an interesting question. People are like, especially people who've never had a massage before. And so if your therapist is asking you ahead of time, there's different ways we can do this. At an event like this, we can work with you over the clothing. So I obviously can't use lubrication or oil or lotion, but we can work over top of the tissue through the clothing. One of the reasons why a massage therapist would ask if we can work on your lower back, or your glutes, is that the glutes, when they're really tight, and that's when you're starting to tighten your butt, right? Tighten your butt right now. What else gets tight?
Everything.
Everything in that lower back area. You'll do it at home right now. Tighten your butt. You'll feel it. Your lower back will get really tight. So when you can release the glutes, and there's different ways to do this, we can do it over the sheets, over the clothing. And remember, if you ever go to a massage therapist and you don't feel comfortable getting undressed, most massage therapists should be trained to work over the clothing like this. We've had multiple clients. I always have this good story. A friend of mine, best friend for 10 years, we've known each other for a long time. She would never want to take off her shirt whenever we work on her. And I was like, she's a perfect example of it doesn't matter how long you know someone or it's a perfect stranger deciding it. If she's not comfortable with it, we just work over the clothing. So with Roger here, what I'm going to be doing is I'm going to work at the glutes, and then we're going to flip him over and work another muscle that's something that most people don't work on when you have low back, and it's called the psoas. So that is the muscle that stabilizes you when you're standing and when you're sitting. And when you sit most of the time, what are you doing? You're shortening these inner muscles here, and they get short. And your curve and your breath changes. And so if you're going to just try to have your therapist work deep tissue until the cows come home, that may not work. And also, we have to do a lot of re-educating because some people think that if I'm hurting, they need to go really deep to make it work. A lot of times if you are going deeper in the tissue and the muscles are then guarding back. So if you're ever on a massage table and you feel yourself starting to clench your teeth, tell your massage therapist. We're not always mind readers, and sometimes we get really into it. We don't feel what's going on. A good massage therapist will listen to the tissue and make sure that it's not too much pressure and that they're not letting the body's not starting to guard. So with Roger, I'm going to work you even more longer here after the video. Trust me, because he's like just talking. He's not educating here. But one other thing is, like I said, if your therapist can work over the sheet, over the clothing. Or what they do, if they are working with a sheet, they will drape you. Anytime you get a massage, you should be fully draped over your genitals, breast area, any areas that are not supposed to be uncovered, unless you're in Europe. That's one thing. One time I had a European come and I walked in the massage and they were just completely like, and that's okay in Europe, but legally not allowed in our area. So what you need to do when you're working with a client with draping and you're working on the glute, what we do is we take the sheet down and we wrap it around the leg. We tuck it underneath the leg so that the glute is exposed, but you're kind of protected there, so you don't feel like anything else is coming out. So we can be working in this area, and you can feel like perfectly secure that you're not exposed too much. Again, it's always to your comfort. Some of the other things that massage therapists may do when they're working with the glutes and the low back is they might do some passive stretching, which is what I'm doing here. Passive stretching means you're not stretching or moving your body for you. You're relaxed, you're letting us work with the body. And this is a really great way to work in the sciatic nerve is a common problem people say they have, and the piriformis muscle is common to be tight in the glute area that causes low back pain. So again, these are things you might not have known. You think, oh, massage is just for pampering. No, we do mostly therapeutic work. A lot of our therapists have gone to the Hack Massage Therapy Training Program, which is here in Harrisburg, PA, and they're more an allied health. They're more allied health school. So we're working with chiropractors, we're working with medical patients, even things like oncology massage, elder care, pregnancy massage. There's so many different types of massage therapy. So that's part of, yeah. So that's part of why I understand like massage is definitely not for just pampering. And of course it's lovely for pampering too. So I'm going to work on your other side when I'm done here, which is the right side that's bothering me, because I will block the camera if I have my back to you. But I want to have you flip over here, and we're going to take your time. I'm going to take that pillow out. And do you need your legs up higher?
No, they're good.
There's another thing. We have these little bolsters to put under your knees, but if you're still experiencing low back pain when you're on the table on your back, putting another bolster or pillow, lifting the knees up higher, is a really great way to take pressure off that low back area. So now I'm going to just kind of palpate, which is our massage term for feel your tissue. We're going to put our fingers down into his psoas and cut into his belly and feel what's tight. And these are the muscles I talked about. They're the stabilizer muscles that hold you upright, and they get tight, and they can sometimes lead to that low back pain. So now I'm working on the right side. And so one of the things, you have either one or two things that happen when you are tight. When a massage therapist is working on you and they start palpating, it's either painful and they say, okay, I'll back off a little gentle, or opposite, contrast, ticklish. And so Roger is always a ticklish. That's why I wanted him to be in the video. I haven't worked on him for a while, so when it gets ticklish or there's pain, we have a sign that the tissue has gotten tight, that's compressing the nerves a little bit, and that's why we can have pain or sensitivity. And so if you're very ticklish, you might be tight in your abdomen all around. So I'm just kind of going really slow. Obviously, if I was going really fast, he'd be geeking out and laughing on the table. Yeah. So I'm going to just do some holds here and work on the psoas. And I just want to ask Roger, because Roger's been working with it for a long time, if he has any thoughts or things he wants to share about the benefits of massage therapy from a therapeutic aspect for him. And he said he's comfortable being on camera. You can probably go and I think this angle is probably good to kind of talk to her there, looking over there.
So Kara started working on me quite a few years ago, and I had restless leg syndrome, and John Hopkins abandoned me. They said they would help and they couldn't. It was almost 2 years of seeing Kara. I don't take medication. I haven't had medication. I still have issues, but massage takes care of it, and I'm ever so grateful. So if you don't think that massage is therapeutical, I am living proof that it is. If she can take me off medication, we're doing good.
Hashtag therapeutical.
Hashtag therapeutical.
So yeah, we see that a lot at our clinic. We see a lot of people come in with low back pain, hip pain, post-surgery scar tissue that's causing pain or lack of range of motion. I had a woman that came in before that she had a full hysterectomy. And it's a really funny story. I went into her partner's place of business. I had not been massaging for 2 years because I've been back behind the desk helping all these people do the things. I haven't been massaging for a while, but I came in and he said to me, "My girlfriend hates you." And I was like, "Who is your girlfriend?" And he says, he said her name. He said, "She's one of your clients." She said she's upset that you're the best massage therapist and she hasn't, you're not working anymore. I said, "Oh, okay, that makes sense." So I ran into her again recently, and it was so beautiful because, again, this is the thing that we need to educate people about. The massage is not just for pampering. She cried. She said, "You don't understand how much you changed my life." And we see this all the time. And it's really beautiful. She had a hysterectomy, and she was in so much pain she couldn't walk. And I knew from doing a type of massage called myofascial release, a connective tissue massage, that when I was feeling it in her abdomen, it felt like since that organ, that uterus was taken out and there was displacement, like her organs in there had to know where does everything sit, because it was sitting differently. There was a whole much more space. And I felt that where the scar tissue was, where she was cut open, was causing some congestion in the tissue and the nervous system. So she was having a lot of pain. And I was doing this psoas work, but deeper down in the abdomen area. And it was about an hour treatment, and she had been in pain for I don't know how long, and she got up and she said, I'm not in any pain. She could walk. And her surgeon wanted her to come in and go back in there because they said it was probably the scar tissue that was causing her to be in that much pain. So these are the things that as we educate people that massage is not just for pampering, and we have more schools like HACK, that are allied health schools that are supporting people who are going into the medical field with massage therapy to understand that this is something that's absolutely necessary. It should be covered by insurance, you guys. It should be, unless you've had a car accident or some medical, some physicians or corporations or wellness centers have our, things. We do take those flexible spending accounts, FSA and HSA cards, so that's nice. But still, I believe, and we all believe that massage therapy should be covered by insurance for these reasons, because there's so many uses for it. Not just physical pain, headaches, migraines, fibromyalgia, but if someone is dealing with stress, chronic stress, anxiety, sleep issues, these are things that Roger's shaking his head. And I think you've seen Jupiter.
I have.
Jupiter, she specializes in this relaxation type of massage. She's really good. You get on her table and you're like,
You're out.
my brain stops thinking and racing, and I feel like a new person. Yep.
You're out.
Yep. Kevin, our massage therapist, Kevin, he works very much with therapeutic. He does a lot of great deep tissue and very relaxing work. Abby, who's behind the camera, she specializes in neck work and very much works in a way that she will work and look at what's detailed. And she's also with prenatal and works with pediatrics, so children under 18. Yeah. So Jen Wagman's been doing massage for over 10 years. She specializes in pain. She works with a lot of the elderly clients as well. We have Jenny Taylor. We have two Jens. She specifies in working with people with chronic pain and functional movement, because she works with stretch therapy too. So if you're not into massage and you don't want people touching you, she can do a therapy that's stretching the muscles, helping create more movement, and also loosening up some of these tight tickling muscles just through stretch. Because some people don't feel comfortable with massage. So yeah, we have Emily also. She's been doing massage for 15 years. Miss Tyra works very well with. She loves the health aspect of things too. She's really wanting to get into deeper work with detailed work. She's a detail-oriented person. And who else am I missing from our massage therapist? I want to make sure I mention everybody. You're not a massage therapist. She raises his hand. Erin, she's also a therapist that works with myofascial release. She does I think she does reflexology as well, but she also works with prenatal, and she does the structural integration. So Mimi and Erin both, and myself, do work with the connective tissue that's looking at your posture, similar to what a chiropractor would do. And we look at that with you, and we say, okay, what shoulder's higher than the other? What's going on with the feet? And these are things that are important to know, because if you're looking at somebody from a structural perspective, if you have more weight on one side of your, like say even right now, you're leaning, the camera woman is leaning on one side, you know that glute on that side is getting tight. Then that low back is going to also get tight. And if you chronically stand that way or sit that way at a desk, then that whole one side, and then that one shoulder is going to come up and compensate for the other shoulders down. And then you're like, my shoulder on this side hurts, and then you work on this shoulder the whole time. The therapist is like, I'm just going to work that. Like, but what about that left leg that's causing the whole imbalance in the first point? Why can't we get you balanced from this ground up? So there's so much more to talk about. It's so fun. But massage is not just for pampering, George.
I'm convinced.
I know, right? So thank you, guys.